25 million people continue to be exposed to asbestos in the workplace.
So there's a big cost to humans using asbestos in dollars and lives.
Research that goes into these decisions has to be directed by independent, unconflicted scientists.
It's not something that just affects workers, it affects everyone.
Saving one life is great, but saving many more is what I hope to accomplish.
Making a profit off of people's pain and lives is wrong.
We can't quit, not as long as there are hundreds of thousands of people still to be diagnosed.
Ban the asbestos once and for all.
Good afternoon once more, and thank you, Linda, for bringing me here. It's been an absolutely brilliant time. If I can use such a word or such a term for such a serious occasion. I've heard so many absolutely wonderful stories of courage, and I've met so many wonderful people that I can't believe that there are people coping with these illnesses in a way that I could never imagine possible. I respect each and every one of the warriors that have spoken, and I must say that I'm going back to Nigeria much more greatly inspired by your stories. Thank you very much. In Africa and Nigeria in particular, we are facing a different set of circumstances than what you have here. I think our stories are more closely aligned to Gopal's for various reasons, and maybe with the Brazilian experience, even though we don't have that much of a problem with asbestos as these other places. But culturally, I think we're more closely aligned. The World Health Organization affirms that despite the severe health warnings and the considerable hazards, asbestos is still widely used in mining, manufacturing, and in so many other applications in many developing countries, and especially in Africa. And the reasons for the continued use of this is already quite familiar to most of you. This slide there shows orphans that live in an abandoned mine area in Swaziland, a place called Bulembu. And these children, amongst 300 other children, have to pass through these abandoned mines on their way to school every day, all right, being exposed to the asbestos in the air from those mines. It used to be a thriving town, it's now a ghost town. This is Bulembu in 2017. This is a worker in Zimbabwe in a drying room without any respiratory protective equipment whatsoever. One of the major areas in which asbestos is used in Africa and in Nigeria is as asbestos roofing sheets. That's the most common use we have for asbestos in Nigeria. And it's cheap. It's what most people can afford if they're not using thatch or some palms in the village. So getting them to not use asbestos roofing is it's difficult because of the economic implications. I'll talk a little bit about that as we go along. But this is what quite a few of them look like. These, of course, are the poorer parts of town. I know that the picture quite a few of us have about Africa is not really as rustic as this, but the greater parts of the continent are still this way. These are children playing in the shaft of an asbestos mine in South Africa, Pomfret. children of the poorer, children from the lower economic demographics have to have somewhere to play. They've got to go out and play like other children, and they end up in these places where they get exposed. And it's anybody's guess what they grow up to become as time goes on. What are the challenges faced in the greater part of Africa? You've got lack of regulations, no legislation, no guidelines, no rules. It's everybody's game, and everything is fair game. There's a serious lack of awareness, and this cuts across board. It's not a matter of education. It's just people just don't know. There's an absence of political will to do anything about it. Gopal has talked a lot about that, and I think even in Brazil, the politicians are in bed with industry, and it is in their interest to ensure that things remain the way they are, and that the status quo is maintained. In Nigeria in particular, and in Africa in general, there's a serious lack of records, lack of data. There's no record keeping, so to speak, so you don't have any figures to rely on, to even work with, to show the effect that asbestos has had on people, and how many people are suffering from exposure to asbestos and other workplace cancers. And then, of course, you've got the economic factors, which I'll also mention very briefly. We've got 54 countries in Africa, out of which only 4 have asbestos regulations, have asbestos laws. Okay, Zimbabwe, South Africa, Gabon, and Egypt. You might argue that that's 4 more than the United States, but we still got only 4. The other 50 countries in Africa have got no regulations whatsoever. Okay. There's a total lack of understanding, a total lack of awareness of what these effects could be, and like I said earlier, this cuts across all demographics. I took this picture of this young man who was working on a construction site, and what he's got all over him is cement. And I asked him why. Why did he? First, he was working without wearing anything, which isn't strange in that industry in Africa as a whole, and in Nigeria in particular, to find people working wearing only boxers in some cases, and flip-flops on the construction site. So when I took this picture, I had a brief chat with him and said, why do you have this cement all over your body? And he was quick to let me know that that was the evidence when the boss came that he had been working, right? That if he was clean, then there will be no way that the boss will believe him that he had been working, that he had to cover himself with cement. But I said, do you know that you could get seriously ill and seriously harmed with this? He said, no. He didn't believe me. So while one could say that because of his level of education is why he's so ignorant, what then do we say about her? This is the county executive member for Kiambu in Kenya, and the name is Mrs. Esther Njuguna. She's like a member of the local parliament, kind of, so she's not illiterate, she's not ignorant, and she actually was conducting journalists on a visit to an illegal asbestos dump, and she stood on the broken asbestos talking to people. All right, just shows the level of awareness and the level of knowledge that is in the continent about the hazard and the risks posed by asbestos. This statement was made by a commissioner, the commissioner for housing in Lagos. Lagos is the biggest city in Africa, and a population of 20 million people. So this is the commissioner. After that, they visit to him and try to talk to him about asbestos. So the very next time he goes on TV, he announces that asbestos ceilings are carcinogenic and that people should go get rid of them. All right? I had to call him up and let him understand that that's not what I told you. You don't just go up onto the roofs and start ripping them up, you know. But that is it just goes to show. So what are we doing about it? Just children in a swimming pool, swimming in the pool of water in an abandoned mine shaft. Okay. What can be done? What have we been doing? We've been my NGO has been engaged in advocacy and enlightenment across the country, talking to people about the hazard of asbestos and the risks it poses, and trying to bring people up to a stage where they at least are familiar with what the problem could be and what steps they need to take to protect themselves when working. And also we've been trying to get government to at least put in some guidelines, guidelines in place, even if legislation is slow in coming, at least let there be some guidelines for people in the construction industry especially who are going to be working with asbestos. And of course, self-regulation by industry. We've been talking to the various construction industry members. In that picture, I was talking to a building and machinery exhibition conference in Nigeria, where we had people from various sectors of the construction industry and encouraging them to self-regulate. There are one or two big companies, Eternit being one of them, that have voluntarily stopped the use of asbestos in the country, but it's still a long adult road ahead, and we hope that as we go along, we'll get more and more people to sign up and do the right thing. Hopefully by next year, when we'll be also joining the Global Asbestos Week celebrations, or I don't know if to call it celebration now, but the Global Asbestos Week event, that the benefits or the fruits of the effort that we've been putting in so far will begin to manifest, and hopefully we look forward to having Linda and ADAO over in Nigeria sometime in the coming year, and hopefully I'll see each and every one of you again in the near future. Thank you very much.